Patient Care Fundamentals and Intentional Rounding is presented by Elizabeth Grist, OAM, the Director of Clinical Services for Nursing and Midwifery at Hunter New England Local Health District. Elizabeth will share the benefits of implementing intentional rounding to provide safe care of our older patients.
When hourly rounding is done well, it's really valuable to the patient. Patients love it. You go in, you introduce yourself, you tell the patient that you're going to be there every hour to check on them, check on their needs and see if they're comfortable. Patients feel secure and well looked after. And they know that when a nurse is coming back, that someone will be there to listen to any concerns that they have or any questions that they have. And that's very important to people when they're in hospital as well. Intentional rounding is one of the building blocks for a safe ward and is a component of the comprehensive care minimising harm model. Intentional rounding supports staff to provide fundamental care. Intentional rounding, or hourly rounding as we call it in Hunter New England, it's a process that supports the comprehensive care and the planning for the comprehensive care for your patient. And it's not necessarily just popping your head into the door, it's actually having a good look at what's happening for your patient and doing everything possible for your patient at the one time. That includes asking if they're comfortable, are they in pain, are they comfortable in their bed, checking their devices, looking at the environment around them, and particularly it's about checking to see if people want to go to the toilet. You might ask why. Our data shows that the majority of falls occur when people are trying to get out of bed to go to the toilet or going to the bathroom unaided on their own. So we think that if you ask your patient at that time, would you like to go to the toilet, and do all the cares for the patient whilst you're there, you've got a really great chance of covering everything that that patient needs. It's best for the patient, and it's best for you as a staff member. You're going to find that your buzzer doesn't go off all the time because you've done everything possible for the patient at that one time. So I'll give you an example. Mrs. Jones might say, I've already been to the toilet, you don't have to take me, or I'll go in a little while, because oftentimes patients don't want to bother us. So it's really important that we actually can say things like, look, I notice that you haven't been to the toilet for a couple of hours. I'll just go with you now. Invariably, a response will be, no, it's okay. But, you know, we're professionals and we know how to communicate in the way that's respectful to the patient, but also ensuring that the needs are met. So, saying things like, it's okay, I'll go with you. I'll just make sure that you're safe. I'll take you to the toilet now. So communicating in that way is very important. Hourly rounding covers all of the patient care fundamentals. So you assist the patient with their personal care needs, and that can include checking their skin. You know that sometimes there are wounds or lesions. It's a great opportunity to have an overall assessment of your patient's skin. The dental hygiene, making sure that their teeth are cleaned and they've got no pain. Toileting, which is so important, particularly with falls reduction. The showering environment. Make sure that you take all of your patient's clothing and needs, etc., to the shower with you. If you do have to get something extra, press the buzzer and call your staff member. The data shows that many of our falls occur when frail elderly people are left alone in the shower or bathroom. Pain, checking to see whether your patient is any pain when they move or when you ask them. Devices, checking to see that they actually are then wearing their hearing aids or their glasses. And while you're checking the patient care fundamentals, seeing if the devices such as cannulas, catheters are all comfortable for the patient, pain-free and still functioning well. And make sure that they've got a comfortable environment so that they can sleep. When hourly rounding is done well, it also reduces serious incidents and injuries for patients, and particularly around falls and any adverse reactions that might be occurring for patients. The ward is a lot quieter with buzzers not going off all the time. I spoke to some nurses once at a facility that had introduced intentional hourly rounding, and one of the nurses told me that she felt initially that she didn't have time to do hourly rounding because she had so busy answering buzzers of her patients. Now she said her buzzers never go off because she does most of the tasks for her patient at the one time. It's amazing when you see the effect that good intentional hourly rounding has on a ward or a facility. Leadership with intentional hourly rounding is vital. Unless it's led from the top and everybody's engaged, it's going to be really hard to implement. And the why is really important. With any change, telling the staff or letting the staff know the why is the most important thing. And I think everybody at work is here for patient safety and good positive outcomes. And that's a huge why. To keep your patients safe and free from injury is an amazing achievement. The other really important why is for the staff. It does make planning your day so much easier. And it's really wonderful to see the impact that really good intentional hourly rounding has on a facility. Comprehensive care, the ward, the patients, families. Without good leadership, it's very hard to embed. And it does take consistency as well. Consistency in explaining to people, to staff, to patients, why hourly rounding is important. And after a little while, it becomes self-evident, and it's a wonderful thing when it's embedded well. Resources to support intentional rounding are available on the CEC website.